Welcome to The Healing Voice, Healthy Living with Newman Regional Health.
We're your hosts, Casey Hastings
and Sailor Middleton.
Each episode, we sit down with medical providers from right here in Emporia, Kansas, to explore practical tips and insights that help you live a healthier, more informed life.
But first, let's hear from the leader of Newman Regional Health herself, our CEO, Kathy Pimple.
You know, navigating all the health information out there can feel overwhelming. As someone who cares deeply about this community, I want you to have a trusted local source you can count on. This podcast brings you direct access to the experts who care for you and your families every day.
Thanks for joining us. Let's get started. Today, we are joined by Dr. Christina Faulkner, a board-certified OBGYN with Newman Regional Health. Born and raised in the Emporia area, Dr. Faulkner returned home to care for the women and families of Lyon County with skill, compassion, and deep local commitment. We're honored to welcome her to the conversation today. Welcome.
Hi.
Thank you for being here.
Happy to be here.
Yeah. This is a long anticipated one for us. We were really excited to invite one of our wonderful OBGYNs to be on the podcast. So,
thank you for having me.
Yeah. So I want to start us off with just telling our listeners who you are and what led you into this area of medicine.
Well, my name is Christina Faulkner. I really go by Chris. It's always hard for me to answer because it's been a long time ago, but I remember being in 5th grade and learning just a little bit about embryology and just being absolutely fascinated. My aunt still tells how I went home and followed her around while she was putting away laundry and was like telling her all these little facts, and she was like, how did she remember all of that? And so from there, I just kept up. It just was what interested me the most. When I went to medical school, I kept an open mind before I did my rotations. But then when I did my OB rotation, it was just really obvious to me that was where I wanted to be.
Yeah. I wonder if that happens a lot for providers and physicians, if they're like pretty young and they find something that just interests them and they land there.
Yeah, I don't know. For me, it was definitely just what interested me. I think some people, it's a personal experience that happens, like a family member is sick or something like that.
Right.
But for me, it was just, I just thought the whole thing was fascinating.
Yeah.
Always have. Still do. So
really cool.
Yeah.
Good. We're glad that you are still interested.
Yes. Yes.
And how many years have you been practicing in Emporia?
Almost 18. It'll be 18 this summer, so just in a few months.
Yeah. Wow.
My whole career since I left residency.
Yeah.
So.
Wow. Well, we're lucky to have you.
Thank you. I'm happy.
Yes. Dr. Faulkner, when people hear your title or specialty, what do you wish that they understood about what you actually do day to day?
I think people know the things that I do as far as deliver babies, do surgery. Those a lot of people don't understand. I do surgery, I guess. But I think what they don't understand is I spend the majority of my day talking to women, educating women about their pregnancy, their body, the surgery, all of those things. So actually, I spend the majority of my day talking to women.
So you said that some people don't know that you do surgeries. What does that look like? What kind of surgeries do you do?
I do hysterectomies, diagnostic laparoscopies, treatment of endometriosis, treatment of urinary incontinence. Those are the basics. I mean, sometimes we just take out an ovary or surgery for ectopic pregnancies, C-sections.
Yeah.
Yeah.
Okay. I just want to note that V-Notes is a surgery that you do. And can you tell us a little bit about that?
Yes. So it is a way of doing a hysterectomy laparoscopically, which we've been able to do for a long time. But the V-Notes requires no abdominal incisions. So it's nice for cosmetically and also just for pain. So no abdominal incisions at all. Everything laparoscopic goes vaginally.
Yeah. And correct me if I'm wrong, but the last I knew, you were the only provider in this area that does.
Well, Dr.
that
Castile
surgery.
does them too. So her and I, as far as I know, we still are the only ones in the area that do it. Yes.
Closest would be like Kansas City.
Yes. I believe they do them at KU Med.
Yeah. So that's, huge. I'm so grateful that you guys do that here.
It's been really great. The patients that have had it really seem to love it. They recover really, really well. Usually go home the same day.
Wow.
It's very nice.
How amazing to have that locally as well, just at home.
Yeah. Okay. What excites you the most about the work that you're doing right now?
Well, I've been doing the same work for most of this time. Yeah. Delivering babies doesn't change much. It's delivering babies, but there hasn't been, a lot of big changes in that, but it's still very exciting, especially for first-time moms. It's still exciting and fun, and also moms who I've seen them through multiple deliveries, so that's fun. And the V-Notes that you just brought up is exciting because it's new. I've been doing that for a little over a year now, so that was that's pretty exciting.
Yeah. And I was going to say, Dr. Faulkner, I remember a conversation, but the generational care, being
Yeah.
able to provide that for multiple women in our community.
Yeah.
So maybe delivering a baby and then, years down the road, being able to deliver theirs.
I'm getting to that point.
Okay.
At 18 years, I'm
That's
getting to that
so-
point.
yeah.
I don't know. I don't think I have anybody that I have done that for, but it's definitely in the near future, I'm sure. Yes.
Yeah. Or at least maybe seeing their kids.
Oh,
and that
yeah.
sort of
Or I have
thing.
patients that come in and I say, oh, you look familiar. And they say, oh, well, you delivered my granddaughter, my grandchildren. And then they're coming in for a different kind of care. And
Yeah.
it is neat to be able to take care of the whole family that way.
Yeah. That's really
That's special.
sweet. Yeah. I know I have had a lot of friends that you've helped deliver their babies and they've loved having you.
Oh,
so.
well, that's sweet. Thank you.
So when you hear the phrase fertility health, what does it really mean to you?
Fertility health is really just health, honestly. I mean, if you want to maximize your fertility, you just need to maximize your general health, right? So look at weight control, and that, because obviously that's a big issue in our society right now. Obesity is a big issue. So being in good cardiovascular shape, you don't have to be your ideal body weight, but being in kind of the normal range of body weight, those are probably the most important things for young people, because most young people aren't having problems with chronic hypertension or those things. If you have diabetes, getting your blood sugar under good control before you try to get pregnant, just really it means just being healthy.
I love that it's just laced together with your own health.
Yeah.
It's
You
not
got
a
to take
separate
care of
issue.
yourself. It really isn't.
Yeah.
Besides starting prenatal vitamins before you start trying to get pregnant, there really isn't much else that you need to do other than just optimizing your general health.
Okay. Well, and that kind of leads right into my next question, because I know many people think fertility care only matters when someone is trying to get pregnant, but why is fertility health important even before or outside of that stage?
Yeah. Well, all the choices you make in your life, we all know what healthy choices are, right? Eat your vegetables and fruits and maintain a healthy weight and exercise. All of those things affect everything in our body is connected. So that's true for fertility too. So just staying healthy. And also, I mean, doing regular gynecology checkups is important. If you have any kind of infection that can lead eventually to infertility someday if it's not caught. So just taking care of just regular health maintenance leading up.
I probably know a lot of people that would assume, maybe the year leading up to trying to have a baby, they might try to take care of themselves a little bit more, but maybe not outside of that.
Yeah, I mean, you can only start from where you are right now, right? So you can't go back to when you were 16 and do everything perfect. But if you think anything you want your body to do, it's better to take care of your body now, right? And asking your body to develop another human and then deliver that human and, go through all of the changes that are associated with that is a lot to ask of your body. So be kind to your body so it can be kind back.
Very true. Yeah. Very simple. Well put. Yes. Well, Dr. Faulkner, I think as a young female, eventually hoping to aspire to be a mom, it's a very exciting thought. It kind of leads into the next question about what are some early signs that our bodies can give us that our reproductive or fertility health might need attention, but sometimes are overlooked or not normalized.
I don't know if maybe they're overlooked, but irregular periods is the most obvious one, right? So if your periods are a problem, if you're not having regular periods pretty much monthly, I mean, they don't have to be exactly on the same day by any means, but within, a 21 to 35 day cycle, then you should see either your primary care doctor or your OBGYN. And then also pain, so pelvic pain. Some can be normal, but that doesn't mean, we can't make it better. But some things like endometriosis, we believe can lead to infertility. We know women with endometriosis untreated have higher rates of infertility. We don't exactly know how it causes it, but those kind of things, getting those things treated and taken care of are important before you ever think about getting pregnant.
Maybe for listeners that aren't aware, don't experience it, could you define a little bit about what endometriosis is?
Yeah.
So endometriosis is where the lining of the uterus, which is called the endometrium, so the inside lining, is implanted in other parts of your body where it's not supposed to be. So that can be in just the peritoneum or the lining of your abdominal cavity. It can be on the lining of the bladder, bowels, any place it's not supposed to be. Then it's called endometriosis. And it causes pain.
Yeah.
How do women find that typically?
Generally, people have pain before, during, and after their cycle. And it's different than cramping. Cramping can be very painful as well. It's a different kind of pain usually. It may be in addition to the cramping, but usually they describe it differently. The only way to really diagnose it is through laparoscopy. Unfortunately, we don't have an imaging test or a lab test where we can diagnose it, but through surgery we can diagnose it.
Do you have age ranges that's typically being diagnosed, or what is maybe the youngest? Or
I think the youngest, I don't know the youngest like world record or anything here, but typically it would be late teen years would be the youngest. And then it can go all the way up to menopause, basically. Okay. Generally, though, it tends to be a problem, I would say, late teens through 30s for most people. Usually, if it's a big problem by your 40s, you've dealt with it because it's painful.
Gone on long enough.
Yeah, it's gone on long enough. You figured it out. And we've done something about it.
Yeah. And you can do that procedure here.
Yes. Yeah, that is a procedure that we do. And I think just having regular checkups too, maybe you don't know what's normal and what's not because you only know what's happening with your body, or maybe you don't feel comfortable talking about it with family members or whatever, but having regular checkups can help you figure out these things. You don't necessarily have to know all of these things yourself, but just when you go to see your provider, just, talking to them about your health stuff, that includes your menstrual cycle.
Yeah.
And they can help you figure out maybe that is kind of what we see a lot and nothing to be concerned about, or should you be concerned?
Okay. Yeah, that's really helpful information there. In your experience, what's one myth about fertility that you wish we would just retire?
Oh, that's a tough one. I'm not sure. I do hear people say a lot that they were told that they couldn't have children, and I don't know who they were told that by, but nobody knows that until you try. So until you try to get pregnant, we don't know if you can get pregnant. There are labs that can be done that maybe can sort of give you odds, but at the end of the day, nobody knows. So don't assume you can't.
Yeah.
Not only just for your mental health, because maybe you want to, or maybe you don't want to, and you're assuming you can't, and then you don't prevent, so it could go either way on that one.
Yeah. On that topic, if somebody had been told that maybe in their teen years, maybe in their 20s, but they are kind of thinking that they would like to explore having a child, what do you recommend?
You can make an appointment for preconception counseling with any OBGYN to talk about that. Assuming you have a uterus and you have ovaries, there is no way we can predict in your teens if you're going to be fertile or not. We might tell you it might be harder for you for some reason, but that doesn't, not being able to is just not true.
Okay.
We don't know.
It's encouraging.
Really, encouraging and eye-opening, because I think I've heard other people say that before.
I have so many patients that have told me that over the years. Like, I was told I would never be able to have children, and they have 3.
Yeah.
And obviously you can go all the way up to IVF. There's definitely ways, and sometimes it doesn't work out, but we can't predict that.
Okay. Yeah.
It's also encouraging to hear that you offer preconception counseling.
Yeah.
I didn't know that you offered that either. So that's
Well, one of the things we talk about is just the cycle. And so we can kind of tell, are things normal? Is there anything different you need to do? There may be some labs to check. We may help you optimize thyroid disease, diabetes, your health, talk about prenatal vitamins, which ones to take. Is there anything else in your particular medications that you take that you shouldn't take once you do find out you're pregnant, that kind of thing.
So when someone comes to you with questions or concerns about fertility, what does that conversation really look like?
It depends. If it's concerns like, will I be able to have babies, that I can't really answer that one for them, right? I don't know. I can tell you, based on some health things, whether it might be more difficult for you or not. And then if they're already experiencing infertility, then it's a different conversation, right? Then we talk about what path we need to go down to start to figure out maybe why and what we can do to try to help. Dr. Kissel and I both do infertility to a certain point, and then after we do that certain point, we can also refer to a subspecialty in the OBGYN field, which is reproductive endocrinology. So we can do intrauterine insemination, we can do ovulation induction, and maybe 3 to 6 months worth of care. And even if you want to go to an REI, we can help you figure that out, where to go and all of those things. So it depends on if they're just wondering, but they're not ready to try, versus if they've been trying. And usually I tell people, if you have been trying 9 months and no positive pregnancy tests, that's the time to go ahead and make an appointment.
That's helpful.
If you're older, if you're talking, you're pushing mid-30s, which is older only for fertility, right? It's not actually older. Then maybe sooner, maybe more like 6 months.
So how do you help patients feel empowered rather than overwhelmed when they're navigating those fertility concerns?
That is difficult because there's a lot of emotions surrounding fertility, obviously. So I suppose the best thing we can do is just try to take time with them, answer all of the questions they have, try to explain things to the best of my ability. And, I have great nurses that have been doing this for a long time, and they are resources for them to try to sit and talk. And we have people in our office that have experienced infertility, and I think them talking to them, showing them that we care, we understand, all of those things is the best we can do to try to help them feel less overwhelmed anyway, or at least feel like they have someone in their corner.
And even touching to hear that there's maybe other nurses in the room who have also walked a similar journey.
Yeah.
But to support those patients alongside that. It's very touching. It kind of goes into the next question, if you have anything more to expand on that. But fertility conversations, like you said, often involve many emotions, whether that's uncertainty, grief, or pressure. How do you create space for that in your care?
I think mostly listening. Sit down and just listen and tell them whatever you're experiencing it's okay. Other people have experienced it. It's not weird, because I think sometimes people feel even guilty about feeling guilty, or, all of those different emotions, anxious, depressed. We also can give them resources for therapy, for counseling, if they need that. Yeah, we just try to come at it from an angle of compassion.
Yeah. I remember when we first got the opportunity to start working with you, I didn't realize that there would be fertility services in, a rural community.
Yeah.
So that was super encouraging to hear. And then to hear you share about how you hold space for those people.
Yeah, I think just as a patient, being open and communicating to your feelings helps too, because sometimes miscommunications happen, right? Because I don't know what you're thinking unless you tell me. And if you're thinking, well, that's upsetting because of X, Y, or Z, just, trying to keep the lines of communication open.
Yeah. What do you think the next generation is getting right or getting wrong about fertility awareness?
Well, I can tell you one thing they're getting wrong. So if you see something on TikTok, don't assume it's true, and try to look for, I know everybody's going to look things up on the internet, and that's fine.
Yeah.
But try to look for more reputable sources. Like Mayo Clinic has a good patient site. Cleveland Clinic has a good patient site. There's lots of resources out there that are real resources versus just, well, I saw it on TikTok, so it must be true, because it's a lot of it certainly isn't.
Yeah.
10 seconds of, this little clip, and it's just not based in, I'm sure there's good advice on there too, but how do you separate the good from the bad?
Right.
So
yeah, it is
I
tricky.
definitely don't recommend you get your health advice there.
Yeah. We had Dr. Anna Lasota on our last podcast, and she did talk about if you're finding information out there that you're confused about or are curious about, bring it to me.
Oh, yeah, absolutely. Definitely write your questions down. We can talk about them.
What's the small first step that someone can take to better understand or care for their fertility health, no matter their stage, where they're at in life?
I really just go back to fertility health is health. I mean, you can't really separate the two. It is important to take good care of your body, do the things that you know that you should do, exercise, eat well, maintain your weight. And then if you have any chronic diseases, make sure you're going to your regular primary care to take care of those things. Those are all important. Being screened for chronic things, whether it be pap smear or gonorrhea and chlamydia testing, all of those things. Practicing good, safe sex practices, all of those things are important.
Yeah. I've heard you mention a few of these things throughout our time together today. So if, a family or a woman is coming to a point where they are having a hard time conceiving, what are those next steps that you typically follow here in Emporia? What does that look like?
First, we have to discuss general health stuff and discuss their menstrual cycle. I mean, if they're not having periods at all, that's a different question than someone who's having periods monthly and not getting pregnant. But basically, it's lab work, checking to see that the tubes are patent, and then we can do ovulation induction if they need it. And then we also need a sperm sample, sperm analysis, because 40% of fertility is male factor, 40% is female factor, and 20% is we don't really know.
Yeah. I have read quite a bit about sperm health having a larger impact.
There's studies out there that say there's declining testosterone levels in men and declining sperm counts in men. I don't take care of men, so I don't really do that. I mean, we do the analysis, and then if there's an issue with the count or motility or those things, then we refer to a urologist.
Okay. Yeah.
I was going to ask what that next step was.
Yeah. People always assume, right? Or the woman assumes it's something wrong with me. And sometimes they look at me funny because always in the first visit, I say, I recommend a sperm sample from your partner. And they may say, well, he's already had a child. Well, that's fine, but that doesn't mean that his sperm analysis is the same now as it was 5 years ago. Sure. There are things that can happen. So regardless of past history, we still recommend.
Yeah. And how much of that process is done here in Emporia?
Usually, if the tubes aren't patent, then they have to be referred right at that point. So that's early in the process there, because then they have to skip the tubes, which is IVF, and we don't do that here. But if the tubes are patent, usually about 6 months. It also depends on age. The older you get, the quicker we refer. And so fertility actually begins to decline actually in your early 20s, but it's just a really, really slow decline until your mid-30s, and then it drops off faster. So my patients that are in their mid-30s, if they're 35 and over, I immediately offer a referral. And then some of them say, well, I want to do, some basic stuff first, or maybe it's going to take a couple months to get in there, and so we do some basic stuff while they're waiting to go. But definitely after 6 months, even if they're very young, I would refer at that point.
Do you have an IVF clinic that you typically work with?
Yeah, it's Kansas City or Wichita, really. So there is an infertility clinic in Wichita that's very good that we send people to, and then we send people to KU Med as well.
If fertility health were treated like heart health or mental health, something that I feel like is easily talked about every day, and we see it all the time. If it was talked about that openly, what do you think would change?
I don't know. I've never really thought about it. So in my office, there is nothing taboo. I mean, we talk about everything because that's just the nature of our business. But I guess there are a lot of emotions around it, and we don't have a good history in medicine of doing studies that are just for women, on women. So, yeah, I suppose we would make some advances in understanding because if we talked about it more, maybe there would be more money for more research and that kind of a thing. And maybe people wouldn't feel as guilty about it, like there's something wrong with them because they can't get pregnant. Partly they feel a betrayal from their body, which is, it's a hard, that has to be worked through. But some of them, I think, feel guilty or less than or those things. And so maybe that would help. I know in mental health, that's certainly been something that's improved as it's been talked about, right? It takes away the shame factor. So maybe that would happen.
So what keeps you hopeful about the future of fertility care?
I think we keep making advances all the time, right? In all areas of medicine and our understanding. And I think that will continue. And I feel like we do talk about it more now than we did in the last 10 or 20 years, where there are lots of sources of information. You have to be careful which ones you use, of course. But yeah, I think for this generation, there's a lot less that is taboo. There's a lot more conversation around women's health and periods. It's like you can say period, it's fine. It's nothing to be embarrassed about or ashamed of. It's a normal bodily process.
And a vital bodily process.
It's very important, absolutely, yes.
It's exciting to hear that it's shifting from feeling ashamed to being empowered.
Yeah, I definitely think I see in the younger women less shame. And there shouldn't be shame. Why be ashamed of what every woman does?
Well, Dr. Faulkner, it's been wonderful having you on today, and also just knowing so much about you and how much you care for our community. So on behalf of Casey and I, thank you.
Yes, thank you for having me.
Yeah, it's been so fun. But where can listeners today learn more about the kind of care that you provide, or start a conversation with a provider like you?
Call us. Call our phone number. Yes, just give us a call. Definitely, my nurses, like I said, are awesome, and they can direct you the right direction.
Seek them out. Again, we're just so thankful for you taking the time to share your wisdom with us today and just share about yourself. We are grateful for everything you do for our community. We know that you are making a massive impact on this community. So thank you.
That's nice. Well, hopefully this helped somebody out there.
Yeah. And thank you to our listeners for joining us for this episode of The Healing Voice. We hope today's conversation offered helpful insight as you work toward better health.
If you've heard something you'd like to learn more about, we encourage you to reach out to your primary care provider. They're your best partner in making informed decisions about your well-being. Be sure to tune in next time as we continue sharing trusted guidance from the experts who care for our community. Together, we're committed to helping you achieve your healthy goals.